Hello everyone and welcome to another day of high yield USMLE questions. So today we are going to talk about renal. So this is a 48 question in the medicalized question bank. So we have a 45-year-old male patient presented to the office because of swelling of the entire body for the past 4 months. According to the patient, he frequently gets a swelling of his entire body, including his face and legs. There is no associated shortness of breath or fever. The patient was recently treated for pneumonia. Past medical history is not significant. Vitally, the patient has a blood pressure of 130/70, blood pressure, heart rate of 90, temperature of 97. On examination, there is pitting edema of the lower extremity and abdominal distension. Lab tests revealed nephrotic syndrome and biopsy confirmed focal segmental glomerulosclerosis. So remember, this question is not really hard. They already gave you the diagnosis, which is biopsy confirmed focal segmental glomerulosclerosis. Here. So this is a nephrotic syndrome here, and one detail that I put here is the pneumonia here. So patients who have nephrotic syndrome, they lose a lot of proteins in the urine. 4+ is the proteins. They are greater than 3,500 milligrams in 24 hours. That's the loss of proteins they have in nephrotic syndrome. They also lose opsonin factors, for example, opsonizing factors like C3b. Also, they lose immunoglobulins, and if you lose opsonizing factors, immunoglobulins, there are certain immunoglobulins that act as an opsonin. For example, IgG is a powerful opsonin of bacteria. So you get frequent infections, particularly with encapsulated organisms. Commonly, it is Streptococcus pneumonia. It's the Shin organisms, SHIN. This Shin organism. So S is for Streptococcus pneumonia, H is for Haemophilus influenza, N is for Neisseria meningitis. These are encapsulated bacteria, and you can get infection of these, especially the Streptococcus pneumonia. The patient recently had pneumonia, so probably that was the Streptococcus pneumonia. So right, so which of the following is associated with this patient's condition? So remember, here it's a more kind of memorization type of question. You have to note some of the risk factors that are associated with focal segmental glomerulosclerosis. For example, among the options, Hodgkin lymphoma, wrong answer. This is associated with minimal change disease. HIV is the right answer. Focal segmental glomerulosclerosis is associated with with morbid obesity. Is also associated with HIV, also associated with heroin use. So these are some of the things that focal segmental glomerulosclerosis is associated with. HIV nephropathy is a form of focal segmental glomerulosclerosis. Then HCV, wrong answer. HCV would be membranous nephropathy. So remember, in membranous nephropathy, you see patients who has hepatitis B or C are at risk, hepatitis B and C. Also, patients who have autoimmune conditions like SLE are at risk. So this is SLE here. They are also at risk. Tumors are also a risk factor for membranous nephropathy, but not focal segmental. So hepatitis B, C, rheumatoid arthritis, SLE, solid tumors. These are the risk factors for membranous nephropathy. And says wrong answer. This is seen. This can be associated with membranous nephropathy, and also minimal change disease, but not with focal segmental glomerulosclerosis. So bottom line, focal segmental glomerulosclerosis is associated with HIV. So you have to test for the HIV to rule it out. So Hodgkin lymphoma, again, wrong answer. That will be minimal change disease. So remember, the patients who have nephrotic syndrome are at risk of some certain conditions. One is infection, which we already talked about, with encapsulated organisms. Also, they're at risk of thrombus formation. They can get thromboembolism, and the reason for that is antithrombin 3 loss in the urine, as a protein. So hope this video was helpful, and if anyone is interested, they can actually email me here for tutoring. Also, I will put links in the description where you can find my Step 2 CK notes if you want. And see you in the next video.